Good night, you sleep now.
Goiter is majorly caused by iodine deficiency in the body when a person does not eat foods rich in iodine, and the condition is common in women.
The thyroid gland expands and forms that swelling in the neck.
The thyroid gland is at the front of the throat and grows around the trachea or the windpipe, the esophagus, which is the food passage, the blood vessels, and the nerves. Other causes of goiter are thyroid conditions such as hyperthyroidism, caused by overactivity of the thyroid gland when hormones known as thyroxine are secreted in excess.
They may or may not even have a swollen gland in the neck, but they have eyes protruding out, they grow thin despite having enough food. They even lose, the hair becomes sparse. Little by little, they become weak because their muscles also become weak.
With hypothyroidism, the hormones secreted are very low, and it is mostly dangerous to children.
If it catches the child when it is still a baby, then they fail to grow. They remain small dwarfs, or if not, then they may have some nerve problems. They are deaf, they are mute, they cannot move.
Hyperthyroidism is the commonest thyroid condition in Uganda. Other causes of the condition are nodules that lead to multinodular goiter, especially when the body is iodine deficient.
If the thyroid gland realizes there's a little iodine in you, it works so hard to trap the little iodine that is in the system. So eventually, it all uniformly enlarges.
Cancer of the thyroid also causes goiter. But what is iodine?
It is got from seafoods, fish, sea vegetables, yogurt, in cheese, in cow's milk, and commonly now we have iodized salts.
Animals like cows, from which humans get meat and milk, need to take iodized salt. Iodine should also occur in the soil, but many highland areas like Kigezi, Kapchora, and some northern parts of the country, as well as those near the Rift Valley like Nebi, have inadequate iodine because the iodized soil is washed away, hence making the crops iodine deprived.
It is a bit ironical because those highlands are the ones which grow again cabbages, which actually remove even the little iodine in the body.
The goiter situation is getting out of hand here in Uganda. Here at Mulago Hospital, they receive about 25 to 40 cases of patients. 6 of these are always operated on. And this is just weekly. A dose of medicine goes for 1 million shillings, and patients who come from villages and cannot afford a treatment give up and return home. At the end of October, however, Lady Luck smiled on some Ugandans when a group of surgeons from Egypt conducted free operations at Kibuli Muslim Hospital.
You know how many people came for the day of the screening? You will be surprised. Over 200 people. We picked 80 to be done at Kibuli.
The treatment of goiter depends on the cause, but in most cases, surgery is needed when it is big.
It can be total, removing the whole gland, in which part we have to give the patient replacement hormone therapy. And if we remove it partially, the patient may not need hormone therapy.
As soon as the operation is finished, we remove our endotracheal tube, and we have to make sure that they are talking.
But goiters which grow inwards are the most dangerous, and investigations may not show them unless a chest X-ray, a CT scan, or an MRI, magnetic resonance imaging, is used to visualize the internal structures.
Then you see this huge mass in the chest cavity.
And like they say, prevention is the best treatment. And that is why the policy of universal salt iodization has been promoted in Uganda since 1993. According to the policy, all households need to consume iodized salt. However, 90% is got from Kenya and the rest locally.
The problem comes when you go deep in the villages where poverty is really very high. You still find them using crude salt, which is not iodized, and they sell them in very small cups.
Experts warn that the future could be bleak because of this small population which cannot afford iodized salt. However, the bottom line is the empowerment of people economically to improve their incomes so as to afford this basic commodity. Florence Nalimba, NTV.